honored to have Bryan Buckley present a veteran's journey to expanding access to medical cannabis and overcoming barriers to research. Bryan is the co-founder and CEO president of Hellman Valley Growers Company, a medical cannabis cultivator based in San Diego, California. It's a nonprofit cannabis business that donates, ready for this, 100% of its proceeds to Battle Brothers Foundation, a nonprofit founded by Bryan that is dedicated to researching medical cannabis treatments for veterans with ailments such as post-traumatic stress disorder. As a special operations team commander with Marine Raiders, Bryan led multiple teams in deployment to Operation Enduring Freedom, Trans-Sahara in Africa, as well as Southeast Asia and Operation Enduring Freedom, Afghanistan in the Helmand province. Bryan developed rapport with numerous host nations, forcing enhanced capability and capacity with the host nation units and briefed U.S. ambassadors. Bryan led a 20-man Marine Raider team to Afghanistan that mentored, trained, as well as conducted over 40 combat operations at Afghan Special Operations Battalion. Bryan also deployed twice to Operation Iraqi Freedom with Marine Infantry and Marine Reconnaissance. Bryan is a recipient of the Bronze Star Medal with Combat Distinguishing Device for heroic service and a Purple Heart Medal for wounds received during combat operations. And welcome, Bryan. And I think you're the only one today that's wearing a suit and tie, so you look
dressed to the party.
Welcome.
Well, I appreciate it. And you guys can hear me okay? The world is
loud and clear.
We're good. All right. Well, that's perfect. Well, John, I appreciate the introduction, and to everyone at home listening, really appreciate you guys taking the time to spend the day with all of us here. I've been listening to some fantastic panels, a lot of knowledge, and a lot of great information being passed. And I just know with the momentum that is happening right now, it's just going to continue to grow, and we're going to prove the benefits of what medical cannabis can do. I wanted to start off with just telling my own personal story of how did I get to this spot. When I grew up in an area called Doylestown, Pennsylvania, and it was a big time football program there called Central Bucks West High School. And during that time, I started getting recruited by the United States Naval Academy. And I remember how proud my dad was. He was like, this is great. Naval Academy. Oh my goodness. Look at all these opportunities you could have. And at that point in my life, I had no desire whatsoever to join the military. Figured I'll just go to college, play some football, have some fun with my friends, and if I had time, maybe go to class. Well, that all changed on the morning of September 11th, 2001. Woke up in our apartment, started seeing some of the incidents that was going on. To be honest, I thought it was a replay of the attack in 1993. It wasn't until I received a phone call from a friend from back home, and he was explaining to me, I think we're under attack. And that's when I saw the second airplane strike the World Trade Tower. It was a, crazy day for all of us. My own personal journey, I, went to a couple classes. Some were happening, some were not. Went down to the football complex, and I remember I jumped up on the table to get taped up, and the trainer looked at me and says, I don't think we tape up today. So went back out into the locker room. We had 3 big screen TVs and probably like a dozen or so guys from New York City. And, I had to, it's kind of funny. I feel my age now. I have to explain, cell phones weren't what they are now back then. And everyone was pretty reliant on landlines still. So a lot of them couldn't even contact their family. And I remember our coach came in and he wanted to have just a quick helmet practice with us just to kind of get our mind off of it. And one of our captains stood up and said, Coach, I don't think we practiced today. And he goes, that's fine. He's like, guys, go home, call your loved ones. We'll let you know what's happening this week, but we're probably not going to play football, I have a feeling. So went home and back to the football apartment with my friends. And, we went out and got a case of beer and just watching TV like everyone else, I'm sure, in the world was. And there was a lot of talk and a lot of frustration. And we were starting to get more reports of people that we lost or who were missing at that time. And it was just kind of one of those weird moments for me where I just walked into the bathroom and looked at myself in the mirror and said, it's time for you to go earn your citizenship. So it was at that moment I knew that somehow I was going to get involved in this fight. So I finished out the football season, went back home in December over the holiday break and explained to my parents my desires to join the military. They were a little bit in disbelief. I think it really scared my mom. My dad was excited, but also a little bit apprehensive about it. But, we went forward and finished out my spring semester at the University of Massachusetts and then transferred to Villanova University, where I joined their NROTC program. I spent 2 years there. Once I graduated, I received my commission to the United States Marine Corps and became a second lieutenant and went off into Quantico, Virginia to receive my officer's training. I was selected to go into the infantry, which was my choice, and went down to Camp Lejeune, North Carolina, and deployed to Operation Iraqi Freedom in Fallujah, Iraq. When I returned from that deployment, they said, hey, you did a pretty nice job. Why don't we think about having you try out for Marine reconnaissance, which I was all about. So went out, tried out, made it, and they rewarded me by sending me back to Iraq 6 months later. So once I came back from that deployment, they said, hey, we have a new thing here called Marine Special Operations, now known as Marine Raiders. They're like, why don't you go out and try out for that and see what you can do? So a couple hundred of us went to the selection. I think about 30 of us made it. And I was one of the 30 who was picked to move on to special operations, and spent majority of my career as a special operations team commander. As was mentioned, did some deployments to Africa, some deployments to Southeast Asia. And of course, Afghanistan was a really hot button at that time. So I went to Afghanistan. Where I was sent to was an area called the Helmand Province. Some of you may know it, or some of you may not, but I will just tell you, and this isn't a bragging point, it was by far the most volatile area in all of Afghanistan. Really what would happen there is the Afghans would grow their poppy, it would cultivate into heroin. Taliban would sell it, they would receive tax from it, and it was basically the way they could fuel their insurgency. And it was a very important revenue stream for them, and it's something they did not want to give up. So the fighting there was hellacious, to say the least. IEDs at your feet everywhere. The enemy was very good at what they were doing, and it was just a very volatile deployment. And, this is not, again, another bragging point. We just lost a lot of people during that deployment. A lot of people got wounded, including myself. And I had one colonel tell me, he's like, we think this has been the bloodiest summer for special operation forces since the Vietnam War. So after that deployment, I returned back. It's, it's a kind of a weird feeling when you come back from a deployment, especially one such as that. And it takes some time to readjust. Again, I said a lot of us, we did receive some wounds, and guys were kind of dealing with the rehab and trying to get back. And really you start seeing kind of mental anguish of people trying to, comprehend exactly what we went through and, the guys that we lost. So it was at the end of 2013, I kind of decided my journey in the military was over. At this point, I was a captain. I was kind of staring down the barrel of being a major. And I just wanted to kind of get on and do something different in my life and, marry my now wife and start having kids and living that life. And it was good. Things were okay, but that's when everything kind of slowed down for me, where things that I compartmentalized were now starting to come to light a little bit. Some of the issues I had to deal with, just not the physical, but the mental anguish. The VA at this point was deemed me 100% disabled. And with that, they also said I had a 100% rating of suffering from post-traumatic stress. It was really starting to happen at the 2014, 2015 timeframe, 2016 timeframe. You really started paying attention, hearing about the veteran suicide rate, that we were losing more veterans to suicide than we were in actual combat. I really kind of lost my identity a little bit when I left the military. I had a high paying job and everything was going great on that side, but just really wasn't fulfilled. And there's just something natural in me that I just like to serve bigger causes. And I wanted to do something to help. So we established a 501c3 organization called Battle Brothers Foundation. The whole purpose of this, we wanted to do something different for our men and women who were stepping out of the military. There's a lot of great nonprofits that help out our veterans who are, I'll say active duty members, if I will. But there's really not much there for the man and the woman once they take off that uniform. And that's where Battle Brothers was kind of born from. And we developed a 3-tier approach of a personal, medical, and economic. So personal side, if you can imagine like a big brother or big sister type network, that you'll have a veteran who successfully has transitioned out of the military there for a new oncoming veteran. and just kind of be there and help them talk and be their guide. We were understanding what was going on with veterans in terms of the opiates that they're being prescribed, or looking towards alcohol as a way to alleviate some of the problems that they were dealing with. And then also on top of that, the post-traumatic stress. So we have facilities that we can actually send veterans to, treatment centers, if you will, that will help that veteran take a knee and, recalibrate themselves and get back out there and do what they need to do and be successful at it. We also understood with some of the veterans, they weren't really receiving the VA disability claim that they deserve. And this is a big deal for them, not only for their own health, but for the health of their family and what it can do for them and the opportunities. And if you deserve to be up in the high rating sides, it's a beautiful thing. And it's a great thing that helps out that family. So we took that on where we could help out veterans move and get the rating that they deserved. And then also on the economic side, it was, let's just find these veterans a job. Let's let them have that sense of purpose like they did while serving in the military, and hopefully avoid a mistake that they can't come back from. It was during this time, another one of my teammates, a gentleman named Andy Myers, who also served with me as a Marine Raider, just was looking really good. I'll be quite frank, a lot of us were probably drinking more than we needed to be drinking. It just seemed like a quick solution and a way for us to maybe go to sleep and all that stuff. But there was just something different about him. And I just asked him, I'm like, what's going on with you? And he's like, well, you ready for this one? He's like, since I got out of the military, I've just been kind of doing my thing, drinking and kind of what we've all been doing. But he's like, I've now decided that I can turn in a fifth of Jack in exchange for a joint. And, cannabis to me was kind of an anomaly at that point. Sure, I had friends who were participated with it, but, it didn't really bother me. It just wasn't really my thing. And I just didn't really understand the plan at all. But he was telling me how much it's been helping him, where he's like, listen, I'm not drinking and driving. I'm not blacking out. He's like, I can go to sleep. I can wake up the next day, feel great. And this has become part of my routine. And the most impactful thing he said, he's like, it's really helping me transition from a warrior to a gardener. So we sat and we thought about it and thought that there could be something pretty powerful there. Now, naturally, my curiosity got the best of me. And I said, well, heck, if it's working for you, Andy, I'm going to try some myself. And my world changed that night. It was probably the first time I got a full night of sleep, and I can't remember. Woke up the next day feeling great, feeling really good, and it just started becoming my routine. I'd get up in the morning, I'd work out, go to work, come home, be with the wife and kids, get them all ready for bed, and then once they're down, I would start using my medication and start my nightly routine of using medical cannabis, and it would just put me down and help me sleep. And then I started noticing some of the byproducts of like the aches and pains my body has. I have shrapnel all throughout my body. My knees, my ankles will just start swelling up for whatever reason. That all started to be reduced. So we thought this is something really impactful and something really powerful. And how can we help veterans with medical cannabis? There's some tremendous groups out there that are advocates, and they've done a tremendous amount of work. And we're pretty much building everything off of their backs. But we wanted to do something a little bit more to prove the benefits. And I had an opportunity to meet with some members of the United States Congress. And to put it blunt, I just said to them, what would I need to do in order to get medical cannabis into the VA system? And they told me, listen, there's a long road to hoe here, but if you can get data and you can get American doctors to be part of a study, you're going to have a very good argument. So typically, as a Marine does, you go, okay, I can do that. And I walked out the door and I sat to myself, said, how the heck am I going to do this? So I was just doing a lot of different things, trying to raise some capital, raise some money, however we could do it, start trying to meet the right people, did a lot of research. And I was up in Los Angeles at one point, and I got invited to a UCLA cannabis symposium. And I just remember how tired I was. And I'm like, man, my bed in San Diego is looking great right now. But I always tell people, don't ever make a comfort-based decision. And I told myself, you just want to go home so you can go to bed. You are making a comfort-based decision. You made a commitment to go to UCLA, so why don't you get over there and just see what's going on? And it was a great topic. Dr. Jeffrey Chen was leading the initiative at the time. A lot of great information, a lot of excitement in the air. And we went on a coffee break. This coffee break became one of those moments that just really changed my life. I met an individual named Alan Blatt, who just came over from Israel, and he works for a company called Niamedic Healthcare and Research. Now, as many of you know, if you are in Israel, you eventually will get conscripted into the military, and you do about 3 or 4 years of service. So all of them are veterans, and obviously they live in a pretty rough neighborhood in the world. So when I was explaining this to Alon, he immediately fell in love with it. And he says, I think there's some way we can go about this and make it happen. So through many months of talking and figuring out how we could do this and learning from other researches and how can we enhance on that. And the big thing just kept coming back to these institutional or academic research that means you would have to fall in line with the NIDA program. But we thought maybe we could do something a little bit different, and seeing what the Israelis were doing with their research, we decided that we wanted to do a private IRB so we could have a little bit more control on this and actually get some product into the hands of veterans that has been grown by cultivators and people who are, nurturing the plant and working on it. This is not a knock on NIDA, but they just have certain limitations on what they're doing. So from there, we said, okay, I got a roadmap. I understand how we can do it. But now we started looking at the dollar signs and how much this is going to cost. So it was at that point we came up with an idea to, why don't we get a recreational brand out into the California market to, one, get our story out there, but two, it can help us use funds and raise funds for our research. And we literally looked at a Paul Newman salad dressing bottle and said 100% of profits to charity. And we talked it over with our lawyers and CPAs, and they explained how that works. And we're like, well, hey, we could probably make that happen. So working with people, trying to get this thing launched. Another great moment happened in my life where I joined forces with a group called Platinum Vape that's based out here in San Diego, and they're a multi-state operator, working in Michigan and Oklahoma and numerous other states, and told them the story of what we wanted to accomplish, and they fell in love with it. And they said, why don't you guys get in here and we're going to help you guys out and get this thing going. And then February 2nd of 2020, we actually made our first sale to get our product, Helman Valley Growers Company, out into the shops and start to raise money and awareness for our research. Now, I want to kind of take a step back, if I may, about how did we come up with the name Helman Valley Growers Company and what's the significance behind that? Really, what we did was, when you served in Afghanistan in the Helmand province in the unit with 1st Marine Raiders, you became part of what they called the Helmand Valley Gun Club, and you get an HVGC tattoo on you. So we put HVGC up on the wall, and really came kind of quick to us. We said Helmand Valley Growers Company. And we're like, that's really great. Let's go talk to the guys, make sure everyone's good with it, and explain what we're doing. And they all embraced it, and they thought it was a tremendous idea. And that's how it came to life. And it's also kind of a shout out to our veterans that this is a veteran organization working to help veterans. So as we started making more sales and we started growing our business, we were able to take our profits and put it back into Battle Brothers Foundation. And we had enough now to start putting a study design together and submit it for an IRB approval. I'm sure many of you know what an IRB is, but if some of you don't, kind of the end state is you've been allowed to conduct human trials using whatever it is you are studying. And it is a very arduous process, especially with what we are doing going through a private IRB. Again, there's been many academic, there's been some institutional IRBs, but nothing on the, very little on the private IRB. We submitted our study back in June of 2020, and everyone felt really good. We had a great medical staff with us. We brought in consultants, and everything was looking very, very promising. But once we got to the IRB, they said, hey, we want to kind of look at this a little differently. What's going on here? You know, do you have a DEA license? And we had to really educate them on the side that, you know, we didn't really want to work with the NIDA program. We had some different ideas here of how we wanted to do it. So eventually, as we started working back and forth with them, they're like, we can go this route where we can work on an observational IRB approval and move forward from there. So literally this thing became one of those stuff that every week I was getting briefed on the IRB, and it just kind of seemed like, is this thing ever going to happen? Well, it did. In the middle of February, we got a call that it was awarded and that we're ready to go. And that was a huge, huge victory for us. Can't explain to you, you know, the proof of concept that happened back in 2016, and to see it actually start coming to life here in 2021. It was a fast 5 years, but also a very painful 5 years to get to this point. So how are we going to conduct this research? This first one being observational, we're going to do a study with 60 veterans here in California. The veterans will come in, they'll receive a non-invasive physical. They'll go through a DSM-5 testing, which will basically evaluate their severity of post-traumatic stress. And then from there, they'll go out, they'll purchase their cannabis. And then for every week for the next 3 weeks, they'll receive a phone call from the doctors at Niametic. and it's going to be very journal intensive. They'll talk about what they've used, the dosing, time, and things of that nature. At the end of the 3-month study, they'll come in for their final interview. We'll gather the last final results we need from them. And then at the end of the study, we'll go back and look at and see what worked the best and what we think would be a very promising formulation to start putting together. And then we're going to do another robust study here again in California, which we anticipate will be about 200 to 300 veterans. And we're going to start going again, working to see if medical cannabis can reduce the symptoms of post-traumatic stress. If we have a successful hit rate, we plan to move this into another state using the same formulation, probably around 50 veterans, just to see again that, hey, we can do this in California, we can do it in a different state, and imagine a lot like a Coca-Cola model that you will get the same thing that you would get in California as you would in Maine. And then once that hits, that's when we plan to go back in front of Congress, raise the right hands and saying, here's your data, here's your American doctors. Can we proceed and get a little more aggressive with our study in order to get this into the VA medical system and into the hands of our American heroes? I kind of want to, I'm starting to wrap up here a little bit, but I just want to kind of talk to you about the importance and why we're doing what we do. Could you just imagine that you go forward and you fight for your country and you come back and you have wife and kids and you just really can't experience things that maybe most other adults would experience at their life. You're dealing with sleep issues. A lot of us suffer with what they call hypervigilance, constantly scanning, looking for threats, everything where you should just be relaxing, enjoying your time with your wife and kids. You're on edge. Imagine the pain that these veterans feel. Imagine when they feel, how isolated they feel, that I'm getting these opiates and I'm just going to go in my room and stay by myself and maybe drink and take some opiates. And at that point, you start kind of maybe thinking, why am I even here? Why is my purpose? And, if you kind of look at our Hellman Valley Growers logo right here, you obviously see the name and you see the cannabis flower. But the 5 stars there are the Southern Cross constellation that can only be seen in the South Pacific. The Marine Raiders of World War II, when they were conducting their nighttime raids on the enemy, would have to utilize celestial navigation. And to do so, they utilized the Southern Cross. So it helped them get to and from the objective. And we look at it here that we had these brave men and women that all raised their right hand. They signed a blank check that's payable with their lives, and they went forward to fight for us, to fight for the American dream that we all get to enjoy. Well, here at Hellman Valley Growers, if you the sign of the Southern Cross is, these veterans might be back here physically, but perhaps they're not back here emotionally or spiritually. And we want to be that guiding light, that beacon in the night, if you will, to help them come back and live the American dream they fought so hard to defend. We know this is going to be a very difficult thing for us to accomplish. We know it's going to be a lot of work, and we know there's a lot of naysayers out there. I mean, I just had someone talk to me and saying, cannabis is a gateway drug. I agreed with them. I said, cannabis is a gateway drug. It's a gateway to the peace that they deserve to live. So with that, sorry, I get emotional when I talk about it. So with that, again, I want to appreciate everyone for your time. Thank you to the MCRAA for all of you taking the time out of your Saturday to listen to what we have to hear. And I'll just leave you with this. Hear me now, believe me later, but we will make this happen. It is said, during times of war, the military will go out there and fight the battles, but it's not, and then the politicians will make the peace. Well, we have the weight now here as veterans. We'll carry this as far as we can. And we just got to make sure when the conditions are set, that's when the peace can be made. And it's a very delicate dance. No one wants peace more than the men and women fighting on the ground. Trust me. But again, when the conditions are set, we'll sit in front of Congress and we'll have that conversation with them. That's time for them to make the peace and let these brave men and women live the American dream. Okay. With that, again, thank you all. I appreciate your time. Not sure if we're going to do a little Q&A here or whatever you guys need, but I'm at your command.
Wow, Bryan, that was touching. I lived in New York City on 9/11, and I'll never forget that day as well. And thank you for your service, not only for your brothers and sisters, but for our country, and really taking a stance on post-traumatic stress. And I apologize at the beginning when I said disorder, because it's not a disorder. So we do have some questions for you. Let me see here.
Great.
We do have questions here.
They're slowly coming.
They're slowly coming. And I'm passionate about everything I do. And so to hear it in your voice, because my voice cracks all the time. And so,
yeah, I think I spent all my tough guy cards, so they're all expended.
You know what? I would share with everybody too, is coming out the West Coast. I cried when Bill Walsh retired from the 49ers. So nothing wrong with crying, my friend. So let me see here. We have a question. How long will the study take, and what is the expectation? And I'm assuming for the post-traumatic stress that you're doing for your brothers and sisters out there.
Yes. So on paper, this first study will take 90 days. Now, there are some extenuating circumstances in terms of the recruitment and bringing people in and them sticking to the entire protocol. But overall, it'll be 90 days. We just wanted to kind of discover what formulations and what types of methods were best for the medicine to get into the veteran. And then from there, we'll start developing our second IRB and start getting ready to put that submission to the Institutional Review Board.
Thank you. And what is this is from Dane. Another message popped up here. 1 second here. What is the likelihood of other groups joining the process of what you are doing?
You know, I'm all for it. The more research we can do, the better. Listen, if it was just us and us alone, which I know it's not, and we were the ones who are going in front of Congress, sure, I think we'd have a really good platform. But the more people coming out and doing research and proving the benefits of medical cannabis, it's just going to make a stronger fight. You know, I think it was the last panel was talking about how this takes a village, and it absolutely does. And more people joining on this, more people believing in it, you know, it's going to only speed things up, I think, for everyone in the country. And what we're really excited about is, obviously, we're working this on the veterans aspect, but it's not like they're just going to approve medical cannabis for veterans only. This is going to be opened up to all the medical patients here in America that could benefit from this plant.
Great. And from Dr. Haas, thank you, Dr. Haas. He's a wonderful man as well. Showing vulnerability is a strength, often not highlighted. Thank you, Bryan, for allowing us to see your strength, and that I know we all mirror that same comment and compliment as well. Is there anything that myself and United Patients Group can do? And I'm certain you'll have a lot of support from this organization and our listeners to help you get your message out there as well. Matt Katz, do you for you, Bryan, do you foresee working with academic institutions?
I do. You know, obviously, I think Ziva, she brought up some very good points, some of the things they deal with at UCLA, but we are going to be working this out of UC Irvine. They are working on a couple of things on their end, but I think more and more come down the line. And I was really excited to read, I think it was 6 or 9 months ago, the University of Pennsylvania talked about how they want to start doing more research, but working with private farms and not going through the NIDA program. And I think we're going to see more of that. And hopefully they can open up the door. But, you know, it's going to be a little bit of a crawl, walk, run, if you will, in terms of, you know, proving that other things outside of NIDA can work and what it can do. And I think that will, there's going to be a comfort level that I think it's going to have to be established. And I think things will open up. Yeah.
And this is what I always talk about, is the pebble in the pond and the ripple effect and getting this message out there too. And this is what today's conference was really all about. And one more here from Catherine Carlson. Thank you very much, Bryan, for your perspective. Praise to you for your successful journey despite adversity. And thanks for Catherine and our other the audience for sharing that as well. And so everyone, you can see why we say Bryan for the last. He's tough to beat, really encapsulates, what MCRAA is all about: removing barriers to cannabis research to further scientific knowledge and to realize the full potential of evidence-based medical cannabis treatments that can positively impact and improve patient health and well-being.